Hi, my name is Naser. I'm a plaster technician at Royal National Orthopedic Hospital and Stanmore, London. And this is my ID. Um, I'm just going to demonstrate how to do a Bawaneh cast in a doll. Actually, it's not a real patient, but we organized to do in a real patient or one number stuff will need to be organized and to take a permission to take a video or photos. We need to organize that. But for now, we'll get it on a doll or like a model. It's a small patient until we. Okay, I prepare my trolley actually. I've got water for casting, and just to check the water will be 15 to 20 degree is the ideal for the casting, so not too hot, not too cold. Otherwise, if it's too warm, because the water will react with the material and will make a heat, so maybe it will cause a burn to the patient if it's too hot. So 15 to 20 will be ideal for patient. I've got my trolley is ready here. I've got felt to cover the bony areas, just to protect to protect the skin and the bony areas from any sores or pressure ulcers or something like that. I've got to stuck in it according to the size of the patient. Will be, this is 5 centimeters, will be enough. I've got padding, tape. I'm going to use fiberglass. This is 5 centimeters, 2-inch Delta Light. This was available here. This is bandage for molding in the paper. We use paper just to cover over the padding, just to help, and will be easier for removing the cast. My scissors, pin, marking pin, and I'm just gonna to start. Okay, I'm going to start now. So before we start, we have to check the diagnosis of the patient, check the details, and check it's the right patient and the right diagnosis and the right cast we need to do. Of course, then we will check the skin before and after doing the cast. We'll check the neurovascular status for any neurovascular changes like pains in needles or numbness before we doing the cast and after doing cast. We'll check again the skin for any marks or any sores also before doing the cast, to make sure that it's not caused by the cast, and we have to document everything before we start. We explain everything for the patient, what we're going to do for him, and we introduce ourselves to the patient. My name is Naser, plaster technician. Just going to do a cast Bawaneh for you, and we have to reassure the patient for everything. Okay, I'm just going to start to put the stock in it. I will say this is 5 for the size of the patient. Start 5 centimeters. Okay, the Bawaneh cast actually is supposed to be like a holder with me, but unfortunately we don't have a holder today. It's just a model, so we're assuming that there is a holder and there's a nearest. The nearest is a bit it's big for the size of the patient, but we're assuming, but we just concentrating on the technique how to do a Bawaneh cast for a patient. Okay, so we put the stock in it. The Bawaneh cast should allow to the patient to have a 90-degree flexion of the knee, and the cast, the foot should be in neutral position. Plantigrade, which is not inverted, not diverted, so will be it's plantigrade 90-degree plantigrade position and neutral. Okay, so we'll start with the padding. That's I'm gonna to do the cast according to the standards of the British Orthopedic Association casting standards. So I'm gonna to do ideal casting. So how we do it according to the high standards here in Britain. We are going to the according to the British standards of casting according to the British Orthopedic Association. So I'll put padding um, around here the knee, so to protect the bony areas and to protect the peroneal nerve, because if there is a pressure on the peroneal nerve, it will cause neurovascular changes, and mostly maybe will cause a drop foot. So we'll make sure that we're not making any pressure on the skin or in the nerves or in the in any part of the foot, so we don't want to cause any harm for the patient. Okay, so that's it here. And I've got two small, this is for the malleolus, the lateral and the medial malleolus. Usually we put it just to protect the bony areas here. I'll start with the padding. So with the padding will be coverage as well 50-50. So just make sure that we cover all the areas of the leg where we put the cast. So just we will not gonna to make sure it's neat and tidy. So we'll put the padding for the malleolus here on this side, the lateral malleolus. It's very important to put a felt or padding around the bony areas, so we're not causing any pressure, ulcer or pressure or sore or skin issues caused by the and we make sure that we cover the heel, because if it's a full weight bearing cast, we make sure we're not, it's strong enough and is covering. And the cast should be 2 fingers below the knee, so the patient will be able to bend. You have got a knee 90-degree bending. I'm going to use a paper. Usually we use a paper here just to under the cast. It's called under cast paper, sorry. This one is this paper. It's not, I don't know, it's not all the places they use it, but we use it here, and it's very helpful and will be easy to remove the cast when the patient is coming. So the material will not stuck with the padding, so will be easy for removal, especially with the kids. Actually, it will be easier to remove the cast. The same thing, this is the padding 50-50. Okay, we'll start putting the cast on. Just going to put my gloves. because actually the padding and the paper it will be easy to put there without okay, I get my trolley always get ready for everything, and have to get extra materials just in case if I need it. That we're assuming there's a holder, but sometimes, you know, if we are working in a busy area in a busy fracture clinic, or you have to, sometimes you have to do the cast by yourself and you hold it by yourself. So we're assuming that is it's a busy place and there is no extra stuff to hold the cast, unless if there is like and there's like, you know, there's some type of the fractures, the doctor who need to hold and manipulate the um, the fracture to get the position or reposition the. Okay. On start. Soaking. I'll make sure it's not, you know, this is the fiberglass. We'll make sure it's not covering the, it's not coming um, to the skin, attaching the skin, because it's very sharp. Okay, and the same thing we'll use the like 50-50 coverage usually with this material. Of course, if I have a proper holder, we will work together. So he will release the where because the leg is too short. So actually, I'm just gonna to. So this is just the first layer. Usually we do slab. So I'll make a slab, assuming that this cast is um, is a is a walking cast, full weight bearing cast. So usually we do, to make it strong enough, we just do slabs like 3 layers or 2 layers or 3 layers. So it's just the patient size is a bit too small, but it's okay for me. Okay, we'll start from here again. Same thing, make sure that we cover all the areas 50-50. The cast, the either cast should be not too heavy, not too and neat, and it's well fitted, support the foot or support the arm. I think 4 sides of the foot will be enough here, so we'll make sure that we do some molding. Mold the arch of the foot. And we use this, assuming that is, we use the bandage over just to make just to help in laminating the layers together. Okay, that's why we use here. And always we talk to the patient, make sure that he's all right. Of course, we will let him know that the material will react to the water, and he will feel warm he will feel warm for now. And now we'll see where we need to trim. Actually, we will allow for the patient our trim, so we allow the patient to see his toes and make sure his just make sure that he can check his circulation and see the color of the toes, and we'll trim it from here. It should be 2 fingers below the knee, so the patient he can bend his knee without, and the cast shouldn't digging at the back of the knee, and shouldn't be too tight around the toes or around the foot, and the same time shouldn't be too loose. So we will trim as needed until the patient he feel comfortable and he can see his, he can see his toes, he can feel it. We check his circulation, of course, and here. Maybe I need to trim a little bit. Should be, if it's bending the knee, it should be enough 2 fingers below the knee, and usually here we put, some places you just turn the stockinette and turn over the beanie cast or the material, and some places they just do. It's different from place to place, but it should be adhere to the standards of casting. We can see all the toes, we check the circulation. Okay, so this is the cast. It's neat, and there's no prominent area, there's no wrinkles, no anything. It looks neat and tidy. Okay, and we will after that we'll make sure the patient is okay, and we give him instruction how to look after the cast. We'll check his circulation. You see 1, 2, 3, 4, 5, and so he can. So he can, it's all open, and we'll ask the patient to check his circulation and recovery, especially check his foot for the color, for any neurovascular status. We'll ask the parents or the who's with the patient to keep check the recovery refill. So we'll make a press on the toes for 5 seconds, and the color should back in within less than 2 seconds. If it's no more than that, that means that there's compression on the on the foot, and we'll ask the patient to check the color. And I'm going to bring instruction. So I'm gonna give the patient, or actually, because if it's a child, we give we have got for adult cast, we'll give the patient instruction, and we have got for the children, we'll give the parents. So I think this is, we're assuming that this is a child or an adult actually, so it's okay. So I'll give him the instruction to keep the leg elevated all the time while he's sitting or lying. Just to make sure that the cast is not getting too tight and the foot is not swollen. So because if he is hanging down all the time, especially after the operations, the foot will get swollen and the leg and the cast will getting too tight on him. Someone give him instruction how to look after the cast. Make sure not to get it yeah, wet. Keep it dry, and we will ask them to. We ask them to order like a special cover. We will call it limbo or whatever, just to cover the foot if they want to have a bath or a shower, to make sure that the cast is dry, not to get it wet. And we'll ask the patient if they feel it too tired or too loose, to give us a call, and if they feel it's too much pain and the pain is not going away, and this pain is increased, so we make sure that the patient is not having compartment syndrome is as a result of the surgery or from the cast. So the compartment syndrome is like a compression on the in the nerves or in the blood vessels, which is may cause losing of the foot. We know, just make sure that there is no any complication of the cast on the patients. It's like compression, like bleeding, like any changes to the neurovascular. Okay, so we will give the instruction, so make sure everything is okay, and we make sure that they read and they understand the instructions, whatever, of course, if they're whatever the language is in English or one in their language. If there is they need somebody to translate, we'll ask for a translator, or we'll ask somebody to explain them to the instruction. Make sure they understand the instruction, and we will give them our contact numbers, and in case if they need to go to the at what time they need to contact us, and because we are off in the weekend and bank holidays, so if there is any problems, they need to go to their local hospital to emergency for them. And that's it. I hope this is a good cast, and hope and the patient and is okay, and that's it. Thank you. Just to make sure that I'm Naser Bawaneh, I'm blaster technician at Rhiannon Orthopedic Hospital, and this is my ID here. And when I get I will organize a proper patient, and I will take a proper video, make sure we'll do in a real patient or a real member stuff, maybe we'll ask to do that. Need some time to organize it. Thank you very much.